No, it's fine. It's early, I appreciate that. Everybody hasn't had their coffee yet. Bore da pawb, and thank you very much for giving me the opportunity of giving you a brief update on HEIW this morning. It looks like you're having a fantastic conference, and really pleased to be with you for the morning part of that. So, as Malcolm has just said, we are still quite a new organisation, so it is worth just reminding everybody in the room who we are and what we're about. So, we are part of the NHS. We're the 11th NHS organisation. We're set up as a special health authority, but to all intents and purposes, we operate in the same way as the other NHS organisations. And importantly, we have an All Wales remit, and that's something which is really critical to us because clearly as a country, we're small enough to do things in a coordinated way, but also as a country, we've got some very different parts of Wales that we need to understand. So although you can see the new building, which is our headquarters on this slide here, Tŷ-dysgu in Nant Garw, we're very clear that actually it's not about sitting in Tŷ-dysgu and thinking we understand the whole of Wales. We need to get out and about, and I'll tell you a bit more about that later on. We're quite small by NHS standards, so we've only got about 400 staff, but then obviously we work very much with people like yourselves on more of a part-time basis right across Wales. So we have quite an unusual staff group, really, and one of the things that's really key to us is making sure that we're not just communicating with people that we see on a daily basis, but how do we improve communication with people who are working with us and for us out in the NHS. And our budget is also relatively small, but again, quite different to most NHS organisations because most of that is spent on education and training. So unlike the rest of the NHS, where a lot of the issues they have are actually around workforce costs and pressures, most of ours are around education and training. So we've had our first birthday this week, as Malcolm said. The main focus to start with last year was obviously making a smooth merger from what was the Wales Deanery, the Wales Centre for Professional Pharmacy Education, and the Workforce Education Service that was part of the NHS already, but also introducing some new functions and appointing quite a few new staff to the organisation in order to fulfil the expectations that are on us as we go forward. But increasingly through that first year, we've been able to start to really get far more involved in the kind of work that we want to do going forward. So our purpose for the future is very much about providing NHS Wales with a single body to develop an integrated and comprehensive approach to the planning and development of the health workforce, recognising that previously that had been done in what you could call silos. There was too much fragmentation, but we all know from our day jobs that actually delivering services to patients and service users is about looking at that whole team together. And if we in some earlier versions of this presentation, we quoted the reviews that led to the establishment of HEIW, which very much said, actually, we need to be much more strategic, much more coordinated, and much more multi-professional. And as you know, the other UK nations have had these models for quite a time now. So Health Education England has been established for a number of years, and NHS Education Scotland. So we're not doing anything that's particularly unique, but what we can do is we can learn the lessons from those organisations. One of the key functions of the organisation from my point of view is very much about making the connection between particularly education and training and workforce planning and what the NHS needs. So what are the critical service issues that are keeping people awake at night in the NHS? What are the big quality concerns, and how can we make sure that we develop the workforce with the skills, competences and capabilities in order to deliver that agenda? And for me, that's a real key reason for establishing this organisation, is to make that bridge and to be part of the NHS. So that yes, we're delivering really great education and training, but we're delivering it in a way that actually helps us address some of those big ticket issues that are affecting patients, service users and our staff out in the NHS. So as you can see, we've got very much a multi-professional focus. We cover all types of professions and occupations across the healthcare system, and actually not just thinking about the NHS, but thinking more broadly around the staff that need to work in independent contractors, in the independent sector, and also in the private sector. As an All Wales organisation, it's really important that we take our lead from some of these key strategic documents, many of which you'll already have heard about, I'm sure, in the course of the last day or so. but in particular a Healthier Wales, which is obviously our long-term plan for health and social care in NHS and social care in Wales, but also things like the prudent healthcare principles, which clearly have a big impact for how we develop the skills of our workforce going forward and how we really develop multi-professional working. Future Generations Act, really critical, very much about being sustainable. We all know at the moment what we're doing with the workforce is very much putting sticking plasters on problems, looking for agency staff, looking for temporary staff, looking for locum staff, not really getting to the root of the problem. And for us in HEIW, that's very much our mission, to make sure we can develop that more sustainable approach to our workforce challenges going forward. One of the key areas of work for us is to make sure that we're not just looking internally at the NHS, but that we are working with a number of key partners, not just in Wales, but also at a UK level. And obviously, Jane's going to speak today from a GMC perspective, really important. A lot of the regulators and professional bodies operate at that level. So from our perspective, very important that we have those wider links right across the UK. And what we want to do is we want to be a really good partner, whether that means supporting colleagues in the NHS, whether that means collaborating with organisations like Social Care Wales, whether that is influencing the regulators and professional bodies, or actually whether that's leading ourselves as an organisation. And our mission is really to champion the workforce issues, to make sure that in all the conversations that happen around service pressures and service change, and what patients need, actually we put workforce right up there at the start of the conversation, not for it to be an afterthought when we've decided what we're going to do. So in terms of our specific functions, education and training goes to the heart of what we do. It's in our title. And as I said earlier, most of our £215 million budget is spent on education and training, £195 million. Some of that goes on the commissioning of undergraduate education for health professions across nursing, therapies, allied health professions. And a lot of it goes on, obviously, postgraduate medical and dental education and some other postgraduate qualifications as well. This amount of money has been increasing in terms of investment into education and training over recent years. And again, this year, we've recommended to Welsh Government we continue that increase to the level of another 15 million for next year's intake into various professional schemes. Because we truly believe that in order to get a sustainable solution to the workforce, we need to continue to invest and increase the numbers that we're training in Wales, to make us even have a chance of being a bit more self-sufficient. And obviously with things like Brexit on the horizon and other challenges, that becomes even more important. In addition to education and training, we have a number of other functions: workforce planning, the development of better workforce intelligence. Leadership development is a new function we've been given, and also careers and widening access and workforce modernisation. So it's not just about education and training. We do have a number of associated functions that go hand in glove with that. So I mentioned earlier on that one of the things that's really important to us is to not be seen as an organisation that is just centred in Nantgarw in South Wales, but is very much out and about. So this year, we have trialled some HEIW roadshows to really get out and about and to meet, in particular, trainees, students, and other people who are receiving education, but also to meet with people like you, the people who are delivering the training. And I can see some faces in the room now that we've met on those roadshows. We haven't been everywhere yet. We've had to pick a few sites to start off with, but these are some of the comments that we've had as a result of those roadshows. So it is something that we feel is really important we continue. And that helps us really get a more direct engagement with people, find out directly from you what you're thinking about what you're able to provide, what trainees are thinking about what they're receiving. And it helps us triangulate with things like the GMC National Trainee Survey and other ways that we've got for capturing the quality and experience of people in the system. So some of the key messages from the roadshow so far, no surprise to you, will be, how do we plan for more appropriate time to be spent on education and training so that people aren't feeling that they're always under pressure and that that's the first thing that goes. How do we build that more effectively into our workforce planning going forward? And how do we raise the importance and profile of education and training to make sure that it is not seen as that optional extra or something that goes when we're under pressure, but something that actually helps us be more sustainable and keep the engagement and motivation of our trainees and students and our trainers. So hopefully you've been able to come and see us on some of those road shows. We've still got a few to go, so please look out for that, because we'd really appreciate your time and find it really valuable to speak direct face-to-face with people. So one of the big areas of work that we're doing at the moment as a result of A Healthier Wales is developing a joint workforce strategy with Social Care Wales. So I'm sure in terms of your clinical jobs, you're very well aware of the integrated fashion of our workforce. It doesn't really matter if we have the best and most sustainable workforce in the NHS. If social care have got problems, actually it doesn't necessarily solve the service issues that we're facing. So Welsh Government have commissioned ourselves and Social Care Wales to do this workforce strategy together, and really looking forward over the next 10 years, not really just sticking to the next 3 years, which, as we know from a workforce perspective, is far too short a period to change anything. And these are some of the themes that are coming from that work. So back in the springtime, we did a lot of engagement and actually engaged with over 1,000 people on what they wanted to see in the workforce strategy. And more recently, we've been out to consultation on some more specific proposals, and we've had about 200 very detailed and comprehensive responses from a range of stakeholders, from individual organisations in the NHS to regulators, to unions, to voluntary organisations, everybody really helpfully contributing what they think are the big issues for us to address in the workforce strategy. So you can see the themes here. What goes through the heart of the strategy is going to be protecting and ensuring the well-being of our workforce as the golden thread that needs to really go at the start and the middle, at the end of the strategy. So valuing and retaining our workforce will be a key theme. Looking at how we're valuing people, how we're building that into reward and recognition packages, how we're investing in CPD to make sure that people feel that they are being invested in and that they want to stay working in the NHS, because as we all know, retention is a key factor. Looking at seamless working, how do we develop teams in a different way? How do we look at not just the health and social care seamless working, but seamless working within multi-professional teams, which increasingly are needed to provide that person-centred model of care. Digital capability and skills. I'm sure many of you have read the Topol review that was recently published by Health Education England. A really key report which shows us how digital education needs to change over the next 10, 20 years to make sure that the whole of the workforce have those skills, not just how we develop the more specialist digital professionals. So we've made that a key theme of the workforce strategy to make sure that we develop this in an integrated way, because not only will it change what we need to learn, but it will change the shape of work as well. Attraction and recruitment, things like Train, Work, Live have worked relatively well for certain professional groups, but how do we really build that up as we go forward, and really looking at not just the global perspective on that, but also locally, how do we improve recruitment and attraction, and looking at the 350 jobs that we have in the NHS, how do we have a much more high-profile campaign for younger people, as well as people in other sectors at the moment, to really want to come and work in the NHS. Education and learning I'll come back to in a second. Clearly that's got to be a key theme. Leadership, and we're very much building our leadership approach in this strategy on the Michael West approach to compassionate leadership, which is very much, again, about putting the well-being of staff at the centre and making sure that we lead through a values-based approach. And finally, looking at the workforce shape. So making sure that we identify those areas where we know we've got shortages at the moment. How do we put those on a more sustainable footing? So in terms of education and learning, just to give you a flavour of what's coming through in the strategy at the moment, what people have been asking us for and asking us to address is how do we make sure that we are developing the workforce from a more multi-professional perspective, and how do we look at building up opportunities for interprofessional learning throughout the education pipeline, whether that's at undergraduate level or at postgraduate level or in terms of CPD. Looking at how we continue to invest in CPD, but we make that more equal across professional groups. Clearly, the models of care for the future are as reliant on primary and community as they are on hospital, but how do we train and educate more people in those settings? We've got a good model for GP trainers, but actually what about the other professions? How do we build that in as we go forward? How do we make education more accessible across Wales? We know that particularly in the rural areas, which is probably most of Wales, it is difficult for people to attract people into the area. So how do we make it easier for people to actually develop their own staff that will stay there, will want to work in that local NHS? How do we look at more digitally enabled forms of learning and more flexible approaches that help us do that? And making sure that as I said, digital is first and foremost in those programs, but also that what people are learning now is aligning to what we think the needs of the service and the needs of patients are going to be in the future, but also meets the needs of the younger generation that are coming through, because I'm sure you've had experience with trainees and students. People these days don't necessarily want the same thing from their careers. They want different options, more diversity, more of a career portfolio approach, and possibly not to work full-time. So how do we really sort of fill that gap from an education and training perspective? So this is the bit that probably overlaps a little bit with what Tom was saying earlier on. So the workforce strategy will be published later in the autumn. Hopefully we'll have a number of solutions to those issues and challenges in it. But in the meantime, in HEIW, we're developing our 3-year plan as well. And we've been putting together what some of our priorities are for education in the future. So we've got a big theme around improving infrastructure. And that includes everything from looking at simulation facilities, which we know are going to be critical or even more critical to the delivery of education going forward. How do we further professionalise training so that people are doing it, feel valued, people like yourselves? We put that on the right footing in terms of the funding of that, in terms of the support you get. So we're very much keen to do that. Looking at how we use digital capability to enable delivery of education, and looking very much at primary and community care, as I've mentioned. SIFT is something that we're also looking at with Welsh Government, and we're hoping that by next year we will have some clarity about what we can do about that agenda as well. We've also got a big piece of work going on at the moment, looking at how we do the undergraduate education of all the other professions other than medicine, and that will give us a huge opportunity to refresh what people are learning. And then some other priorities, again, that I'm sure Tom touched on, things like looking at the employment arrangements for trainees, the single employer model. How do we do that to best effect in Wales? How do we widen access to education opportunities, do more work-based learning? Global engagement, really important to us. How do we really put Wales on the map and have an ethically based mutual arrangement with other countries to improve our training of our own staff and of theirs? And last but by no means least, making sure that we're having an equal offer for SAS grade doctors to make sure that their development is valued as well as a key part of the workforce for the future. So that's just a flavour, really, of where we're at as an organisation at the moment, a bit of a slant on what we're doing around education and training. Hopefully that gives you some assurance that not only as an organisation are we really trying to take that forward, but we're very much planting these ideas in the National Workforce Strategy to make sure that everybody really takes notice of and wakes up to the fact that education and training is absolutely critical to how we develop the workforce in future. It really shouldn't be seen as a cost. It should very much be seen as an investment, and that's really our mission as an organisation. So thank you very much for your time today and for the opportunity to talk to you, and I hope you have a great conference. Diolch.